Good morning, everyone. My name is Carolyn Curry de Castillo, and you're here with another wonderful Unison webinar. Today's subject we'll be talking about is navigating the healthcare system as we get older. As we know, there's a lot of challenges involved in that when your health changes, or just figuring out ways to plan ahead for your health. And joining us today is Vanessa Slobodin. She is a registered nurse, currently now an advanced practice nurse who has gone back to school to get her master's, and a year and a half ago, she just started Next Steps Health Consulting. Thank you for joining us today, Vanessa.
Thanks for having me.
I'll let you get started on this. We were just talking briefly about why you got started with Next Steps Health Consulting, because you're still in the background, you still go to the hospitals and practicing palliative nursing. Is that correct?
Yeah, that's correct. So, kind of my professional background is nursing, as you said, and I've worked for the last, gosh, almost 20 years now in a combination of seniors care, cancer care, and palliative care, which I really love doing. And kind of through that, and as maybe won't surprise people, seeing all the system changes and strains and challenges, started to really see some gaps and limitations in the system that I was doing my best to fill and address within my role kind of in Alberta Health Services. And then a couple of years ago had, kind of two back-to-back experiences with family members who are close to me who then needed to access the healthcare system, one, from kind of aging and one from a cancer diagnosis. And I thought, no problem. I've got this. I can help you, figure out what we need to do because I do this every day. I work in the system. And I was floored with how challenging it was to get the right care at the right time, and even taking it a step back, figure out what that care was, what was important, what type of care we needed, and then how to get the wheels turning. And that was kind of the push that I needed to figure out maybe how I might be able to address that, with my professional experience. And so that's really where Next Steps came from.
And tell us a little bit more about the I guess the kind of services you offer.
Yeah, so with Next Steps, I always say it's my kind of privilege or my opportunity to meet with people and help them answer their anxieties or burning questions about what comes next. A huge majority of the folks that I meet with and talk to are seniors who maybe are noticing that things are getting more difficult or they're having more health issues come up. Or some of the people I meet are doing great right now. They're really healthy, but they're proactive. These are our planners, and they see the news and they worry about what's going to happen to them when they need this system. And so we sit down, whether it's future planning or immediate planning, and figure out what's really important to someone as they're navigating health changes and having to interact with the healthcare system. And then, what are they worried about? What's important and where are the gaps? And so my job and my expertise helps us make a very actionable plan to get them connected to the right resources at the right time. And for some folks, some of those conversations might be around transition planning. So somebody might come to me and say, I live on my own, or, I live in a big house with lots of stairs, and I worry that as I need a little bit more help or I'm not as strong and independent, I'm not going to be able to stay here. But, what the heck happens next? I hear all these terrible stories about nursing homes or there not being enough spaces in long-term care facilities. So what does that really look like? And again, we can sit down and figure out, what's important to them, what they envision as kind of the ideal scenario, and then really talk through concretely what the public system offers, what are the processes for care facilities that way, and sometimes where, private might be a possibility or what that looks like so they have kind of the complete information.
That was a great overview. Now, are you planning to do a slideshow presentation here, or do you want
Yeah,
to
I've
just
got some
go into
slides that
questions?
I'll share
Let's
just
do that
to
first.
keep me on track.
Yeah, for sure.
Now, I can hopefully get it playing here for you. Can you see that?
Sure can.
Fantastic. So I'll just kind of jump in, really my hope and my goal in having the chance to speak with everyone today is to give you some practical strategies. This is what I do in my business, but there are some things that I've learned that I think apply to people in a lot of situations that might be helpful to you now or in the future as you're kind of coming across encountering the healthcare system. So my goal is to, like I said, give some really practical, concrete suggestions or strategies that you can take away and incorporate on your own as you're running into some challenges or encountering the system. And we've talked a little bit about this, but why does a business like mine exist and why are we talking about this? A lot of it really comes from how complicated and overwhelming our healthcare system is and has become, especially in recent years. I think everyone can think of, maybe five stories that you've heard either on the news or from a friend or family member, or maybe experienced personally where someone needed to access care and maybe had trouble finding a family doctor or needed to go to the emergency room and the waits were really long, or once they did, maybe figure out what was going on, there was a long wait for a specialist appointment, and it's intimidating and it's scary to,
Mm.
when we start to think about what would happen to me or what do I do if I'm needing to access this kind of really strained and stressed system. Uh, and lots of times, when we've been feeling unwell or waiting, for a diagnosis or an appointment, when we finally get there, we often end up in a situation where we feel like we have to make rushed or reactive decisions. So even though we've had all this time to think about it, we might only get 15 minutes with a specialist we've been waiting 6 months to talk to, or same thing in the emergency department. We might wait 12 hours for a test and have, 2 minutes for someone to explain to us what those results mean and then what happens next. And what I often hear from folks, and unfortunately I've seen a lot of times, is people get lost and become a patient instead of a person. And what we know, from my experience, and there's lots of research, when people are given the chance to be very clear about what's important to them in terms of their values for their life, their quality of life, their health care, their ability to access the right care is increased significantly. Our outcomes are a lot better. But how do we do that, in the system that we're talking about? There's a gentleman who's a poet and an English professor that does lots of teaching and talks on this subject, named Jim Mulcahy. And he talks about, so he's a lymphoma patient, somebody who was diagnosed with lymphoma that recurred multiple times, while he was also the primary caregiver for his wife who was living with Huntington's disease.
Oh boy.
And so you can imagine that he would have a lot of experience, encountering all the challenges of the system. And he describes it in a really, I think poignant way where he talks about feeling like the more he interacted with the healthcare system, that he was becoming on the wrong end of a telescope. So as a person, he was becoming smaller and smaller and smaller. And that the people who were there to care for him, they're doing their best to do their job, but they're really losing sight of who he was as a person, which is, so much more than just a patient. And while the patient part is important, right? We want the healthcare, we need the healthcare, we need to be in that role sometimes. Um, the kind of care that we receive really should reflect who we are as that person. So trying to flip that telescope around and figure out who we are and what's important to us, and then how do we get the healthcare system to meet our needs from that perspective. So I'm going to go through kind of five strategies that you can take away. Some of them might resonate more than others, but like I said, kind of practical things that you can do to help flip that telescope and put you, as the most important person, or your loved one if you're a caregiver. So the first strategy that I encourage people to think about is what I call asking smarter questions. So it's good asking questions is the first thing we want to do, rather than just sitting and listening to information, but asking the questions we have. But when I talk about asking smarter questions, we're really looking beyond, what's the treatment or medication that will help, and starting to ask questions like, why is this the best treatment or the treatment that you're recommending for me? What happens next after this appointment or this decision? And then the one that I think is most important for everyone, how is this going to affect my quality of life and the life that I'm living? So, it's good when we finally get to access that care, but it's just as important, if not more important, for us to be able to find out how this treatment or care fits with our life and what's important to us. So, for example, if someone is finally sitting down with an oncologist after receiving a cancer diagnosis, and the oncologist starts talking about, radiation and chemotherapy, it's really important for us to understand, what is that really going to look like? What is my day-to-day life going to look like as I go through this? And then after the treatment. And for some people, what that does is help them, put the right supports in place, prevent a crisis. For other people, they may decide, this treatment isn't the right treatment for me, because the impacts to my life are so significant. There's lots of kind of different ways that can go, but we don't really know until we explore more what the impact will be. I also think asking questions like, what are the best or worst case scenarios, for my health and for the situation that's going on? Sometimes it's kind of scary. We want to put our heads down and feel better, do the treatment. We don't like to think about the worst case scenarios, but oftentimes, if we never address what could happen, we're number one, a lot of us in the back of our heads are going to feel anxious about what could happen. We might be kind of ruminating on what the worst case scenario is, even if we never ask the question. And if we ask, it may be very different, or not so scary from what we're thinking of. Or, for lots of people, it's better to know so that they can plan for things that might come up. And on the flip side, we worry about worst case scenarios, but it's also good to know about the positive things that could happen. What are the best possible outcomes? And that helps us, again, look ahead. And we're going to talk about, once we have this information, how can we use it? But it's really important to fill in these blanks. What happens if I do nothing right now? That one feels kind of counterintuitive, especially after I've just said, we're waiting for hours and hours for tests and months to see specialists. And then, gosh, can't even imagine saying, well, what if we don't do anything? Uh, and I'll share an example of what that can look like. And then questions like, how do we know if we're on the right track, right? What are the markers we're using? Uh, the doctor you're talking to, the specialist has probably cared for hundreds, dozens, thousands, a large number of people who on paper are going through something similar. So they kind of know what to expect. But this is our first time going through it. And so it can be really helpful to know how we know if we're on the right track and when we might pivot or do something different. And again, looking ahead, what can I expect 6 months or a year from now? So, depending on the situation, that might mean understanding how our health is going to change. It might understand kind of the benefits and the side effects of a treatment. Sometimes it helps people understand, when am I going to start feeling like myself again? But these types of questions help us frame, is this treatment right for me? What sorts of things might come up in the future? And really, building a plan so that we have control over what's happening to us. I think I said a lot of this, but really we're flipping the telescope, right? So these questions take us from a patient who's getting a treatment for a disease to a person who's living with an illness and interacting with this system. It doesn't necessarily change the treatment that you're going to receive, but it can really change the experience and your experience of going through that. It helps us prioritize things like dignity, independence, quality of life, whatever is really important to us, and starting to think about how we can balance that while we're, dealing with an illness or our health is changing over time. And ultimately, the more we understand about what's happening and what to expect, the more control we have over what comes next. So I said I'd share an example. So I had the opportunity of working with a gentleman by the name of Jim who was in his 80s and had a diagnosis of advanced cancer. So cancer that had spread, and the doctors essentially told him it was not curable. Jim at the time was very, very healthy otherwise, still working full time in a business that he had run, loved to travel, spend time with his grandchildren. And when he sat down with the oncologist, they kind of went through a fairly aggressive treatment plan that would include surgery up front, followed by about 6 months of chemotherapy. And one of the things that stood out to him in the conversation was that the chemotherapy was meant to add time to his life, but they knew off the bat we couldn't fix it. We couldn't get rid of the cancer, and at some point it would come back or make him really, really sick. So Jim felt okay with the surgery. It was a pretty clear plan. He could have, the main tumor removed. His recovery would be about 4 weeks, and then, we expected him to get back to more or less how he was feeling before. But what he wasn't comfortable with was the idea of the chemotherapy, because even though it would probably extend his life, it meant pretty certainly he wouldn't be able to travel. He'd have to take a big step back from his business sooner than he was ready to. And he might not have the same energy, to spend with his family. And so he asked the question, what if we don't do anything right now? Or what if I don't do the chemotherapy at all? And so ultimately made a plan where he just did surgery, recovered quite well from surgery, and then was able to spend several months after surgery, you know, wrapping up some bucket list trips, winding down his business, spending good time with family. And he did eventually pass away, but from Jim's perspective, he was able to, choose quality time with his family doing the things that he wanted rather than being sick from treatment and living maybe a couple of more months, but not in a way that he wanted. And of course, this is going to look different for everyone, but having the answer to those questions and really understanding what could this look like 6 months from now, what is success going to mean in my situation, really helped him make a decision that he was most comfortable with.
You
So
mentioned about the questions. How important is it to have someone else with you? Because I find that sometimes I'll come back from an appointment, I'm like, oh, I should have asked this. But if you had someone else with you, kind of your wingman, to asking is how important is that to have?
absolutely. And it's funny, you're literally asking that as I was turning the slide, and I know you haven't
Oh,
even seen these yet. So
oh my
you're
goodness.
right on track. Yeah, it is it is one of the most important things that we can do is having someone with you. It's so much information. And, yes, I'm talking about asking questions, but sometimes that's really hard to do. Or we get news that is surprising, upsetting, difficult to hear and process, and our brains shut down. And that's normal. That's not a sign of us, not being smart enough or whatever to be able to follow the conversation. It's super overwhelming. And even, for people that have experience in the system or medical backgrounds, hearing information, when they're the patient or talking about a loved one can be really, really overwhelming. And so I think it's really important to have a buddy, have an appointment buddy, an advocate who can attend as many of your appointments with you as possible. I encourage people to assign that person as, the role of the note taker, so that when your doctor, your specialist is talking to you, you can look them in the eye, you can hear what they're saying. You're not worrying about writing everything down, having someone with you whose job it is to take those notes. I'll often say, if you've got really big questions going into the appointment, we want to write those down going in, and then make sure that your advocate, your appointment buddy has those questions. So if you forget them, you get overwhelmed or sidetrack talking about something that comes up, they can, make sure that we revisit those before the appointment is over. And, if it's somebody who knows you pretty well, they can get a sense of if you're starting to feel overwhelmed and maybe there's, a need to pause the conversation to revisit information or just, take a beat because we're processing so much information. And something that I often say to people that may surprise them is that the best advocate or kind of appointment buddy may not always be the first person you think of, or, your spouse, your sibling, the person closest to you. And the reason for that is they care a lot about us. And, they will likely be struggling with a lot of the same emotions and overwhelm that we are for ourselves. And so, you know, having somebody is better than, having to go it alone, having that second set of ears. But, sometimes it's valuable to bring even a third person. Most appointments, most doctors will be happy to allow you to bring a couple of people in with you, or bringing somebody, somebody else. Maybe it's a more extended family member or a friend, or, someone that who can be a little bit more objective, so that they can really focus on their role of note taking, advocating, and having that perspective of really, advocating on your behalf. Because our close family members, they're in it with us, right? Those are our caregivers. Or on the flip side, if you're somebody who's a caregiver, you know how much emotion goes into that. And we do our very best, but inevitably we miss things because we get emotionally engaged in the conversation.
Well, sometimes
And
you're dealing more with your heart, right, than your head if, in that case.
exactly. And thinking about everything I've said, I think we should be dealing with our heart and listening
Mhm.
to our heart, rather than just looking at the medical information or the science and the treatment plan. And so having somebody who can advocate for you kind of helps us balance that. They can kind of take in all that medical information, while allowing you and maybe that your close friend, your spouse, your sibling, whoever that emotional support person might be, can be emotionally present in the conversation. And I had a lady who had been waiting. She'd had some neurologic symptoms, some kind of weakness, some kind of nothing changing super fast, but it was concerning to her. And waited a long, long time for an MRI, and then finally a neurology appointment, after that. And her husband came with her, and they had their list of questions. They knew what was important to them, what they wanted to ask. And then when they sat down and she, got her kind of diagnosis, and they started talking with the neurologist about the future, it all went out the window. They thought they were kind of ready to hear the information and what to expect, but really just found that, especially after so much waiting, they got a bit lost in the appointment. And after she left the appointment, she was chatting with her niece, who happened to be a nurse. And the niece was asking, how was the appointment? What's the plan for this? Are they going to send you a referral for this? And, this lady that I was working with was like, I have no idea. I barely remember when my next appointment's going to be, or what the name of the medication they prescribed is. I have no idea. Like, I feel like we talked about those things, but I don't remember at all. And so the next appointment, she had a follow-up appointment about 6 weeks later. She actually brought her niece, in addition to her husband. And the niece really was able to serve in this kind of advocate role, where her focus was really on getting that information, relaying, to the team what was most important to her aunt, and to her uncle about, the future and quality of life, and understanding the treatment. And then they could, over time after the appointment, chat about it, review the information together. So uh, a good way to look at it, for everyone's family is different, and kind of the support that you have available is different. But looking and seeing if there's someone who can attend appointments with you, to help take that advocate role, can really help us get the best information, um, at the time that we need it, especially recognizing that our time sometimes with our doctors or our specialists is limited and not as much as we would like. So the third strategy is really about anticipating, planning ahead, rather than kind of dealing with health issues or trying to put care in place right when we need it. So really being proactive instead of reactive. And this is where some of those smart questions I was talking about earlier can be super helpful. So if we can ask the doctor, what the worst case scenario might be or what types of side effects or complications might come up, we can start to think about, well, what would I do in those situations? And I definitely acknowledge this can be scary and sometimes overwhelming to do, but it allows us to maintain control and have a plan in place. And what I admit to be, I'm a planner, but I'm also a very anxious person naturally. And so my brain likes to worry about things before they're necessary. And sometimes that's not very helpful. But when we're looking at healthcare and looking at complications from an illness, this can actually be really valuable because once I know, the different scenarios that can happen, I can then put a plan in place. Well, if this happens, here's what I know we need to do. And that actually makes me feel a lot more comfortable and less anxious about things that might come up. And then once I've got a plan, I can kind of put that away and focus on what's in front of me rather than sometimes if I don't address something head on or make a plan for it, it's it's always turning over in the back of my mind. It might keep me up at night, find myself worrying about it and really going down, the what if path. And a lot of times when I ask the question or I have clients ask questions about, what's the worst that could happen or what kind of complications could we expect, they're not as bad as we might be making up ourselves. And so this can be really valuable. But also what this does is help give us a timeline or a time, an opportunity to understand how the system works and how we can get help if we need it. So, for example, if an outcome from a treatment or from getting older, we expect that we might not be as steady on our feet and we might need more help with things like getting in and out of the shower because that's an opportunity people may fall, which can cause other issues. So if we recognize that, what, one day I might not feel like I can do this on my own anymore. What do I do then? This anticipation phase allows us to kind of make a list of here's how I would get home care, involved. Here's how long it would take. Would it cost me anything or not? All those pieces. Whereas if we wait until we're not feeling well or we can't, do some things for ourselves anymore, and then we're trying to make the calls or build a plan or get the information, it's a lot harder and it can take us a lot longer. And in some cases ends up costing people a lot of money because there might be, free or public resources available, but we don't have time to figure them out, or we just need something right now. So this really helps us kind of line up different supports for when we need them. I think it's important to focus on, best case and positive outcomes. That's a really important, positive to have a positive mentality when we're dealing with, changing health or serious health issues. But having a plan for things that might come up can really help us, maintain control and stay on that positive path. The other big piece is if we're anticipating the disruption that some of these complications or challenges may cause is a lot less because something happens, we're going to put our plan in place right away. We're going to get the help we need right away because we already know what we need versus all the time that it might take to figure that out. Uh, we've talked a lot about figuring out what's important to us, what quality of life means, what our wishes would be in different situations. And so this anticipation, thinking about things that could come up, also means that in an urgent situation, if something changes really quickly, the care that we're going to get is much more likely to reflect what we've already figured out is important. Because if we've never thought about it or we've never made a plan like this, then we just kind of get swept along with whatever happens when things change really quickly, without the time to talk about if that's what we would really want or what the alternative options might be. And the other one that, if you're not convinced, the one that usually resonates with people is anticipation and planning is actually the biggest gift we can give our families and our caregivers, because number one, we're having a conversation about, hey, these things could happen. Hopefully they don't, but they could. And if they did, here's what I would want, or here's what would be important to me, and here's what we can do if it happens. And so a lot of the strain that comes, when I talk to family caregivers and having been one myself is, okay, well, if this happens, what does my loved one actually want? It might be different than what I want. And I worry about, am I making a decision that they would want for themselves? Am I there's a lot of guilt around, is it the right decision? And so when we plan like this, and our families or our caregivers who are supporting us can be part of that, we've got a plan they know. And if they need to put that plan in place, they feel super confident they're doing what we would want them to do. So it gives everyone some peace of mind.
Yeah, that's an excellent point because sometimes, yeah, I mean, I've planned and everything for my will because that just seemed like a common sense thing to do,
Yeah.
having kids, but I never occurred to me to do this type of planning to avoid
Yeah.
the hassles it'll cause my kids or family if my health goes sideways.
Yeah, absolutely. And so, sometimes there are kind of formal processes for planning that I'm going to talk about briefly at the end, but a lot of it is informal too, and having conversations with our family, with our loved ones about, generally what's important when we think about our health or the healthcare system, what's important to us. For example, lots of people I meet say, being with my spouse, living together for the rest of our lives is the most important thing. And we would plan everything around that. Other people would say things like being able to continue to travel is a really big value, and I wouldn't want to undergo any treatments or have any procedures that might prevent that. For other people, it's being able to care for their pets, or there are so many different things. And so knowing what's really important to us and sharing that with those around us who, might be involved in supporting us is super helpful when we actually have to face some of these decisions, because we've already got that framework. And then we're asking ourselves, does this fit with the framework we've already made? And just another quick example, from the planning perspective, I worked with a lady who was very independent, in her 80s, living on her own, but knew she was going to have a hip replacement. And her family was very proactive, which is kind of how they engaged me. They just wanted to understand, what supports would be available to her after she got home, what to do if things came up. And so, she had her consult with the surgeon, and they kind of gave her the standard, consent, here's what could happen, here's what we expect, sign here. And her family said, no, it's not good enough. It's not enough information. We want to know what's the worst case scenario. So what if things go really wrong? And so, the example that was kind of given is, what if this hip replacement, when she gets a bad infection, what would that look like? And so they kind of talked about pain and treating the infection, and so they were able to take that a step further and say, well, okay, if she goes home and she develops an infection, she's not going to be able to care for herself. She would need help with showering, with a lot of her care because of the stairs in her home. And so this family actually kind of had some ideas in terms of, okay, how would they get home care? Would they want to use the public system home care, or would they want to look privately? And it was, long story short, this lady, she didn't end up with an infection, but she did have quite a bit of post-operative pain. So she was discharged home. They had some family staying with her for a few days, but then her kids had to kind of go back to work, which was out of province. But she was still having a ton of pain and really having difficulty managing. And without a plan, this is somebody who probably would have ended up back in hospital for a week or two so that she could have, pain medication and have nursing care while her leg was healing. But because her family had been so proactive, they had home care lined up ready to go. They were able to arrange for caregivers to come in a couple times during the day to help her get meals, get cleaned up in bed, get to the shower a couple times a week, and a nurse that was coming in to help with pain management. So she didn't have to go to the hospital, but if there had been much delay in making a plan of that kind, they probably wouldn't have had any choice but for her to go to emergency because she was in quite a lot of pain. So just an example of kind of how that planning can really make a difference.
That's such a great story and an example that in terms of the preventative care.
Yeah, it really, and things tend to work out if we end up not planning, but it often means time in the hospital, which is really busy. I very rarely meet people who say that's where they want to be. And so often the biggest benefit of planning is it keeps us out of the hospital or keeps us out of urgent care, the emergency department, which is generally pretty high on people's lists when we start talking about, what's important. So, this is just a quick reference, if you kind of forget everything we've talked about, 3 questions to take to an appointment. What are my options? So more than just the what's the standard, what are my options? What actually matters most to me when I'm choosing between them? And what should I expect next? So these 3 questions kind of reframe or simplify what we've talked about so far, and something you can kind of put on the fridge or keep with you as you're looking at appointments or planning ahead. So we'll go through our last 2 strategies. So strategy 4, blending the supports that are available to us. And so when I talk to people, they are often very surprised to hear that there is actually a lot of support available to them outside of, Alberta Health Services or whatever pillar of the healthcare system we're talking about. But I will also say the public system is fantastic and it is the essential foundation to our healthcare. We've already identified that there are some strains and some gaps. And so, if we want to have the most control over our health and what happens to us as we age or things change, it's really good to be informed about what else is out there, in addition to kind of what the public system offers. In Alberta, and really generally in Canada, the public system is where we're going to go to get emergency care, for our tests, our lab tests, our imaging, ultrasound, CT scans. It's where our specialists work, right? It's different than in a system like the States. We don't have options to find a cardiologist or an oncologist outside of the public system generally. All the best minds here are working in that system. So we want to be engaged in that system. But when there are gaps or we need help that isn't offered traditionally in the public system, it's good to know that there are lots of resources out there. And I'm not just speaking privately. Certainly, for people that can afford to access some private healthcare, there are things like, private home care companies or family doctors' offices. But, this goes way beyond that. There are so many nonprofits, community organizations that are out there to fill some of the needs that the public system doesn't. And so, again, when we're looking at our proactive planning and we can start to say, what might I need or what would be important, we can figure out who does what, what does the public system offer? And if we're finding there are gaps, what might be out there to kind of blend with that or fill it. So a great example for people who are diagnosed with ALS, there is a very comprehensive ALS clinic in Calgary. It's based out of the South Health campus. That's all public system. When people go there, they are seen generally in one day by a neurologist, so a specialist doctor that treats ALS. They see occupational therapists who help them with equipment. They see registered nurses and dietitians and breathing specialists, and they do all of that in the public system. And then they also get connected to the ALS Society. And the ALS Society is a nonprofit organization that is often, so it's volunteer run. A lot of their volunteers are family members who have cared for somebody living with ALS, and they are amazing at helping people with ALS find equipment, community resources, talk about their experience. They really fill a gap that the public system doesn't. And so, right there in that appointment, we try to get people connected. So, that's kind of one example. Without the ALS Society, people would have long waits for their wheelchairs or their supportive equipment. They wouldn't have somebody necessarily that could come and visit them at home to see how things are going from that perspective. So, really tapping into that is a valuable resource and it doesn't cost anything. So, just knowing that we can be open minded. Um, and, I was talking to somebody actually just yesterday who was somebody who had lived, worked in the healthcare system as a health professional for a long time, and then been diagnosed with cancer, as well as several other health conditions. And despite all of his experience, he was feeling extremely overwhelmed with what to do because he lives on his own. And while he's managing okay now, he recognizes that in the future, he's probably not going to be able to manage on his own. And home care can help, home care through the public system can help with things like getting dressed and showering. But he was worried about shoveling the snow and, getting to the grocery store and tidying his house. And those are things that the public system unfortunately doesn't do. It's just kind of outside of what the system offers. But I was able to connect him to an amazing nonprofit organization here in Calgary called the Center for Living with Advanced Illness. It's a bit of a mouthful, but they have a companion program where they'll match people with a volunteer companion who can stay involved with them over a prolonged period of time and help with, sometimes it's socializing, it's somebody to come over and play cards with or chat. But lots of times it's the logistical stuff that Alberta Health Services can't provide. So this volunteer companion will be able to shovel the snow, give him a ride to the grocery store, help cook a meal, just kind of hang out, but in a more informal way, or like I said, filling a gap that the public system doesn't. And that made this gentleman feel a lot more comfortable about the prospect of staying in his home and not moving, at least not moving for a long, long time, because some of those pieces that he was really worried about, not having family around, are going to be filled. But we had to be a bit creative about how to do that. There are lots and lots of, you know, external nonprofit organizations. Sometimes it can take some legwork, but it's worth kind of digging into what's out there because there is lots available. And then the final strategy to talk about today, which I think kind of ties together what we've talked about and I've mentioned a bit, is really aligning your care with your values. So sometimes this is a bit of a shift. We traditionally live in a society and a system that says, the doctors are always right and I should do whatever they tell me. And it's not to say that they aren't experts and the healthcare professionals aren't looking out for us, but recognizing that, they're presenting information to us that applies to most people, to other people that on paper have a similar condition, but everyone's living a different life with different values and different experience. And so when we make decisions, it's not just about what's medically possible, but it's about what's important to us and how does this treatment or intervention fit with who I am and what's most important to us. And if it doesn't fit, maybe there are other options that aren't, introduced initially because, you know, the standard or the most common one is what they introduce first. And we have to recognize that our system is super busy, right? I've said that probably 10 times by now, and we all know it. And so we do have a responsibility before we, go into some of these appointments or interact with the system to think a bit about what is important to me. Your care team, will do their best to, see how the treatments or the plans they're talking about with you fit with what's important to you, but they often don't have time to kind of sit down and have long conversations about what that might look like. And so it's helpful, again, if you want to stay in control of your care, really helpful to spend some time thinking about your values. What are, I talk to people a lot about critical abilities and trade-offs. So critical abilities are things that for my quality of life or who I am as a person, I need to always be able to do these things in my life. Maybe it's walking my dogs. Maybe it's, taking care of a loved one. Maybe it's playing the piano. Maybe it's traveling. There's all different, maybe it's reading a book. What is truly critical to your quality of life, where if you could no longer do those things, you would feel that that was really unacceptable and that your quality of life would significantly suffer. And then what are our trade-offs? So what am I willing to undergo in order to maintain those critical abilities? So would I be willing to spend a month in the hospital, getting treatment and medication if it meant that I was expected to come home and be able to play the piano again? Um, and what if, you know, I needed surgery in order to do that, and I was going to have a long recovery. Um, and do the treatments or the interventions that are being proposed, are they going to help me get back to those critical abilities? Right? If we're undergoing or putting ourselves or our loved ones through something that's not very pleasant or time in the hospital, and there's no belief that we'll be able to get back to doing what's most important to us, is this how we want to spend our time? And so it's never an easy answer, but starting to think about what's most important to us can help us make some of those tricky decisions as they come up. And ultimately, those values need to be the compass to direct our care. And so I'll just kind of take, 30 seconds for those of you that are listening to give you a chance to think about it. It's not something we think about often. We're busy, we have lots on our mind. But maybe just sit for 30 seconds and think about, if you were in a serious health situation or things were changing, what really matters the most to you and brings you good quality of life. So it's something to think about or reflect on. And then the last thing I wanted to go over with you today is what is kind of the formal piece of all of this planning. Is kind of what I was referring to when Carolyn was, talking about sharing with family around what's important. So there is a process, we call it advanced care planning. You can look that up. There's lots of information available on it. A quick, Google or internet search will give you lots of information. And right here in Alberta, there's several pages and videos dedicated to this, but it's really what we call the formal process of documenting what's important to us. And it's something that we recommend everybody undertake, but most especially, as we're getting older or, we have health conditions, this becomes more and more important. And so there are a few different pieces that go along with this. I won't go into great detail today. Um, like Carolyn mentioned, having a will is kind of sort of tied to this. Lots of us have a will, and that's really helpful. If something happens to us, it tells the manager of our estate, our family, kind of what to do with our resources, with the things that we have. But it doesn't address what we want or what to do before we pass away. And so, medically, we have what's called a personal directive, which, if you've done a will, lots of lawyers will complete a personal directive with your will. But interestingly, it doesn't require a lawyer. You can actually, Alberta Health Services or the Alberta government have fill in the blank templates that you can do on your own. They just require a witness, which could be anybody, your neighbor, your friend. And what it does, the personal directive tells your medical team, if I can't make decisions for myself related to my health care, then this is the person that I would want to make them for me. So, in a perfect world, this is maybe the advocate that's been attending appointments with you, or somebody who has been involved in conversations with you about what's happening with your health and what would be important to you if something changes. A personal directive is only used if someone's going to be incapacitated, so not able to make their own decisions for a long time. So, we see these commonly with dementia, or if someone was to have an accident and they were in a coma and they couldn't understand what was going on. Not as much for kind of day-to-day things or short-term decisions, but kind of prolonged periods. If we don't have a personal directive done and the doctors determine we can't make our own medical decisions, the legal default is our spouse or our next of kin, if you have children. And if there's nobody obvious, within your immediate family, then it often goes to a guardian. So somebody within the government that has to make these decisions. So for some people, that's okay. Other people say, oh gosh, I would not want, a stranger. Or some people say, I wouldn't want my wife or my husband to make these decisions because they're not the best person. It would be too hard for them or whatever. And then it becomes very important that we do these documents so that it's really clear who we would want making decisions for us.
Well, we should,
Uh,
from the way I'm looking at it, we should all have personal directives, just the ways we all have a will, because
yeah,
you don't have to be diagnosed with dementia. You could be hit by a bus tomorrow.
exactly. Yeah, yeah. A personal directive is really valuable for all
Mhm.
of us to have.
And they're not
Uh,
necessarily part of a will, because I don't recall having that, what's
yeah,
going to
lots of
happen to
people.
me if I can't make decisions in the will.
Yeah, if you have a will, and you did it with a lawyer, I encourage people to pull them out and check.
Mhm.
Sometimes I find a lot of people did do one, and they don't remember or they didn't spend a lot of time talking about it. Often lawyers will say, you'll just assume that your spouse or whoever, and just sign it, and that's kind of it. But it's worth checking. And like I said, you don't need a lawyer. So if you haven't done one or you did one and you would change today, maybe who's named on that, you can again look it up. The government templates are easy to find. You can download them and just fill in the blanks. And the way that it works is the most current one is the one that would be used. So if you did one with a lawyer 20 years ago and you printed a new one today and did it without a lawyer, that one you print today is going to be the one that we would use if we ever needed to. And then the other thing that you might hear about, especially if you're someone interacting with the healthcare system, is what we call a goal of care or a green sleeve. And so a goal of care is kind of the modern way to talk about a do not resuscitate order. It's a lot more nuanced than, in the olden days we called it a do not resuscitate order, and that basically told us would someone want or would they benefit from something like CPR? If their heart stops, should they do chest compressions? And that is technically covered in the goals of care, but there are several other designations or kind of levels of care that look at everything from, maybe I would not want, or I'm quite old or frail and the doctors don't think I would recover from CPR, but I would still want to go to the ICU for medication, or if I'm really sick, I would want to go to the hospital to have tests and procedures to figure out what's going on. There is a designation that says, I never want to go to the hospital again, but I actually want to have all the care to extend my life that you can give me at home. So you can have the lab come and see me. You can have the paramedics come and give me IV fluids or antibiotics. I'm happy to have all those things, but I'm not going to the hospital. So I'm giving you a pretty quick overview, but if you're someone that is aging or interacting with the healthcare system, this is really an opportunity to capture your values in a snapshot in case of emergency. So when do we use the goal of care? If things change really quickly and somebody calls a paramedic, paramedics come and see you. They're going to tend to you, but one of them is also going to find this goal of care in your house. That's why we put it in what we call the green sleeve. Once you have it done, we tell people to put it on top of their fridge or on their fridge. And so when the paramedics come out, one of them is going to look for this, and that's going to tell them at a glance what's important to you in terms of your health. And so if someone has said, I wouldn't want CPR, they're going to know that before they start something like that, or vice versa. Even if someone is quite old or sick, but has said, I want the opportunity, to have CPR. I would want to go on a breathing tube so my family could say goodbye to me. That's going to tell the paramedics what's important to us right away. Or for someone who says, my focus is only comfort measures and quality of life at home, they get that information too. So it's really comprehensive when we don't have time to talk. For most things, it's going to be a conversation with your healthcare team. But if we don't have the luxury of time to talk about our options, this really captures those values at a glance.
That's really
Um,
important to know. I mean, all of this has been really important, but that one specifically because it tells me that if that's not laid out, the default, I guess, is to do the help for the healthcare system is to do whatever possible to keep you alive, right? Is that correct?
that that's exactly right. So without any of these documents, the legal default, yeah, is to do whatever we can to keep someone's body alive. And so often there are situations where we know as healthcare professionals that someone won't survive CPR, that even if we do it, they're not going to be strong enough, to wake up and go home. But the paramedics are still required to do it until they get to the emergency department. An emergency doctor does an assessment, and that can be, number one, it's painful to receive CPR. Even if you're very sick, it causes significant pain. But also as a family member, it's quite hard to watch. And so if we know it's not going to help or something that we wouldn't want, we can avoid that, with this type of documentation. um and so that's also why, we have everything on someone's electronic chart, but also that's why we give a physical green folder that goes in the same place in everyone's house so the paramedics can know what's important to us. And we could spend the full hour on, the concept of advanced care planning and looking at this. But we have Alberta Health Services actually has an advanced care planning team. It's a whole department that helps healthcare workers understand it and us as members of the public understand it and to do it. And they offer sessions regularly at the public library. So again, it's something you can look up if you're interested and attend. I think monthly or twice a month they have information sessions where you can go and they'll walk you through this in great detail and help you do it. So just wrapping up, recap. So the strategies we talked about were thinking about your values and goals, learning about your health, really, getting engaged and understanding what's going on, putting a good team of advocates and caregivers together, starting to communicate your wishes and values to those around you, to your healthcare team, and then finally documenting. So that all goes into that kind of advanced care planning. So all of these are kind of, some of them might resonate more with you, but the idea is really keeping you in the driver's seat, so that you can have as much control as possible in a system that often feels like we don't have control. So I'll wrap up here, but again, good to kind of think, are there pieces that we talked about today that you can take away right away and put into action so you feel like you've got just a little bit more control? That's it.
I love that. That was just wonderful. Thank you, Vanessa. So much information that personally was not aware of. And yeah, I'm definitely gonna like take advantage of some of this information to make those plans because I am myself a chronic planner and I like to have all my ducks in a row. But these are some things that I did not consider. So yeah, fantastic. And you're with next. I want to reinforce you're with Next Steps Health. And if someone wants to get a hold of you, we have your information on there, or they can get in touch with us at Unison and to follow up more. If there's any questions, please feel free to our audience to put them in the chat box. We'll gladly take any questions over the next few minutes. One question that I had because I was dealing with a situation with a family member, and it made me somewhat uncomfortable in the office talking to the medical professional because I found that my relative, we were kind of speaking around him, and
Mm.
we it almost like he wasn't in the room, and I felt awkward about that because we were using his name and it was just us talking, and he was perfectly cognizant of what's going on, but he kind of became out of the loop. Do you find that in some cases, and how do you work around that to make sure that that person is included in the conversation when it feels like they're being left out of it?
Yeah, and unfortunately, I think your experience is not unique. And while I've talked about all the good things with bringing an advocate or a family member, I do think that's a risk or a challenge that happens where sometimes our, healthcare professionals will go around the individual, the patient that we're actually talking about. as a health professional, but also as a family member, one strategy that I kind of use in those situations, one is to redirect directly to that, my loved one as much as I can to say, what do you think about this? Or I'll ask, I don't have any problem asking, could you, talk directly to that person and making sure if I feel like, say the physician is asking me a question instead of my loved one, I would just turn and say, hey dad, what do you think? But the other thing, and that I sometimes will employ is kind of setting the groundwork initially by saying, what, my loved one or my client here, they like to get all the information directly. They want to be involved in the conversation, or sometimes they don't. Sometimes I meet folks who want their family to be the filter for information. And so sometimes at the beginning of an appointment or a visit, I'll just lay it out there. Hey, you know what? My mom, she wants you to talk directly to her. I'm here to kind of take notes and fill in, if she needs me, but you can talk directly to her. Or again, sometimes, we've already talked about it, and can you confirm you prefer me to get the information and chime in if you want. So sometimes just setting that groundwork,
Mm.
it's just a reminder. Most health professionals aren't doing it intentionally, but they just need a little refresh.
Yeah, that's an excellent point. I wish I would have known that right off the bat to discuss which way this dialogue is going to go, right? So yeah, that's a great piece of advice to take into it before we have the discussion, that three-way discussion in the room, right? I see
Mhm.
a question come up. When did Next Steps start, and what was the need for services from people been seen then compared to the services you're offering now? And
That's a
so we'll start.
that's a great question.
Mm,
So I've been in business about a year and a half. And actually, Carolyn and I were chatting about this. When I first started, of course, you have a vision for everything, and I thought I would see a lot more folks in crisis, kind of at the point that they were needing to engage services, maybe plan to move from their home, and I did certainly see some of those folks. But what has become more clear and kind of more prevalent in my business is the people who want to plan in advance, and recognizing the increasing strain on the system, wanting to get a comprehensive overview of what to expect, figure out what's important to them, and have that kind of actionable plan, which is something I can provide. If this happens or when this change happens, here's what we're going to do, or here's what you would need to do, and kind of building those plans. And then since I've now been in business for a little while, I'm seeing that some of my clients who I met with initially for that planning, they are getting sick or they are aging, and they may reach out and say, you know what, this plan that we made it super easy, or I've got this additional question, or something else has come up. So it's been interesting to kind of see the evolution, but I was definitely a bit surprised by how many people are wanting or seeing the need to plan in advance, given the increasing strain on the system.
and a follow-up to that question is, where in the future do you believe more people are going to be looking for support and information? I guess, is that going to be more folks like you, or what happens in the future as there's
You know,
more of us are getting to that age?
yeah, and I think it's tough to answer. And by tough, I mean it changes so much, based on the government focus, that we have at any given time. And so, it won't surprise probably most people here. The current government that we have here in Alberta really does have a push towards more private resources and privatization of healthcare. Um, and so we may see that becomes inevitable, that to take some of the burden off of the overwhelmed public system, that's where things go. But I also think there's increasing interest and desire to engage our community support, so those nonprofits, those community resources. But I think ultimately the future is that we're all going to need to be much more proactive and advocating for ourselves and take control, whatever direction or kind of whatever way the political wind is blowing at the time. I think given, the system will be strained for a long, long time, no matter what happens. Ultimately, it's going to come down to us figuring out what resources are available.
Excellent point to leave it on there if we don't have any other questions. And doesn't matter your age, right? Anything you can get a
Absolutely.
diagnosis of anything at any age. You can, fall off a ladder, whatever. You don't know when life is going to take that turn for you. So and plan, plan, plan. Those are the two things that I kept hearing over and over again was plans and consider your values. Because each of us have a different set of values, of course, that we want to live by.
Yeah, and you know what I would maybe end by saying planning can be fun. You know, a lot of what we
Hmm.
talked about today was serious and serious health conditions and facing
Hmm.
the end of our lives. But the other gift of doing it in advance is we can have fun with it. You know, a part of it is my experience, but we had a night with our very close friends, where my partner and I sat down, we had a bottle of wine, and we all talked about what would be important to us or what if this happened. And it was so hypothetical,
Yeah.
but we still got to the same route. And so it was a fun, kind of no pressure way to do it. And so one of our friends did have a very serious health, issue after that, and we knew so much better how to support them and what was going on. So yes, it is daunting and it is scary, especially, the older we get or as we face the system, but it doesn't have to be. And it can be, just a fun opportunity to kind of share and get to know those that we love.
Excellent point. Putting the fun back in planning for the
At
for
least for those of
dreadful
us who are
things.
in type A.
Exactly, I hear you. And like heard our prime minister say recently, hope is not a strategy. So it's all about planning and planning
Exactly.
and yeah, have a planning strategy at the party. Awesome. Thanks very much, Vanessa. I really appreciate this. And we'll be having this up on our YouTube channel within the next couple of weeks. And we'll also, just a reminder to folks that we will be launching Unison TV in the near future, hoping for a spring launch of that. So stay tuned for that. Thanks again, everyone. And we'll chat with you again next week.
Thank
Take
you.
care. Bye bye.